Yeah, depression in males is really common. 1 in 6 males, so it's a little sort of, maybe a little lower than for females, or a little lower than the general population, which is 1 in 4. But we do need to remember that in terms of suicide attempts and suicide completion, that males are streaks ahead of females in terms of suicide. And suicide, I guess, is that the worst outcome of depression, prolonged period of depression, where that spiralling goes right down to a sense of what's the point? There is no point. I don't want to do this anymore. So clearly, males are very vulnerable to not just to depression, but to very serious depression with severe outcome. And for guys, they often are intolerant of their own inability to cope. They have a picture of themselves as having to be robust, having to be coping, having to be a certain way. And so when that starts to falter in them, they don't want to admit it in themselves, let alone to anybody else, like a mate or to their partner or their family, or much less go and talk to a GP about it. But I think that's a tragedy, because depression really just diminishes a person's effectiveness and diminishes their life. Their concentration starts to falter, and so for a guy they might see that as, what's wrong with me, I used to be able to do that, and so they sort of have got this evaluative layer of self-blame and criticism that's coming in to sort of make the whole situation worse, and they can tend to just retreat and sort of try and tough it out and pick themselves back up. But of course we know with depression, because your thinking tends to become quite distorted, the more you isolate yourself, the more vulnerable you are to actually getting stuck in a place that's really hard to get out of.